So that was another retrospective analysis that was undertaken by the Lymphoma Working Party of the EBMT. And basically, the objective of this analysis was to add real-world evidence on the role of consolidation with Brentuximab vedotin in patients with classical Hodgkin lymphoma that had a high risk of relapse after autologous stem cell transplant. So we may remember the results of the AETHERA trial that was published back, I would say that 7 years ago, that demonstrated that in high-risk Hodgkin lymphoma patients, consolidation with Brentuximab vedotin was able to significantly improve progression-free survival versus consolidation with placebo after autologous stem cell transplantation. And after the results of the AETHERA trial, of course, let's say the treatment strategy of classical Hodgkin lymphoma has changed quite significantly. We have, I would say that nowadays, 4 published small real-world data retrospective analysis looking at the potential role of Brentuximab vedotin consolidation in real life. But with this retrospective analysis coming from the Lymphoma Working Party, we wanted to implement this information on consolidation with BV in bigger group of patients in terms of number of patients, and of course being collected in different European countries in the EBMT registry. So basically we presented the results of around 300 patients that most of them fulfill the inclusion criteria that were taken into consideration in the AETHERA trial. So high risk for relapse classical Hodgkin lymphoma patients that received Brentuximab vedotin consolidation. Basically, if we look at the safety profile of patients included in this retrospective analysis, the safety profile was quite similar to the one that we remember from the AETHERA trial, and I would say that quite similar to the one that has already been published in this smaller real-world analysis that I have mentioned before. And if we look at efficacy, the overall survival data were also quite similar or eventually higher in a similar way that has been demonstrated in some of these real-world evidence analysis if we remember the data coming from the AETHERA trial. So basically, it's, let's say, it's an additional demonstration of the efficacy and adequate toxicity profile of Brentuximab vedotin being used as consolidation strategy in patients with classical Hodgkin lymphoma that have a high relapse risk after autologous stem cell transplant.